An oxygen delivery system is a complete unit capable of providing emergency oxygen to a patient. There are many different types of oxygen delivery systems for use in an emergency. Although design variations exist, all of the systems operate in the same general manner. In the United States, the Food and Drug Administration, or FDA, requires that emergency oxygen systems deliver a minimum of at least 6 liters of oxygen per minute for at least 15 minutes. An emergency oxygen delivery system has 4 primary components: an oxygen cylinder, a regulator, tubing, and a delivery device. Factors that affect the ability to provide high concentrations of oxygen include the type of oxygen delivery device or mask, the ability of the oxygen first aid provider, oxygen flow rate, and the seal of the mask around the patient's face. The oxygen cylinder contains purified oxygen. A typical cylinder is highly pressurized to increase the volume of oxygen available for use. Oxygen cylinders come in many sizes and are usually constructed of aluminum or steel. A cylinder valve located on top of the cylinder controls the release of oxygen from the cylinder. The oxygen regulator attaches to the cylinder at the cylinder valve. It reduces the pressure of compressed oxygen inside the oxygen cylinder to a level more appropriate for patient care. A regulator can have a fixed flow, which provides a preset flow volume when the cylinder valve is opened. An adjustable flow regulator allows you to use a flow rate controller to set a flow rate of your choice. Oxygen flow rates are typically measured in liters per minute, often represented as LPM. Most regulators include a pressure gauge to allow providers to monitor cylinder pressure. Oxygen flows from the regulator through outlet ports designed to be used with specialized tubing. Oxygen tubing delivers oxygen from the regulator to an oxygen delivery device. Oxygen tubing has specially designed ends that allow providers to connect it directly to a regulator or delivery device. Oxygen delivery devices deliver oxygen directly to the patient. These devices are attached or held closely to the patient's mouth or nose to create a higher percentage of oxygen in that area. Certain delivery devices are intended for use on a patient who is breathing adequately. These devices allow the patient to draw the oxygen in with their own breath. A ventilation mask with an oxygen inlet port is a very common delivery device included with emergency oxygen delivery systems. Depending on the flow rate, ventilation masks can deliver oxygen concentrations as high as about 50%. A ventilation mask can also be used on a non-breathing patient by blowing through the port on the top of the mask. Use the highest flow rate available between 6 and 15 liters per minute. Make sure the mask seals well on a patient's face. A simple face mask is similar to a ventilation mask, except for the lack of a ventilation port. It also provides oxygen concentrations as high as 60%. Use the highest flow rate available, between 6 and 15 liters per minute. Make sure the mask seals well on a patient's face. A non-rebreather mask can deliver the highest oxygen concentration to a breathing patient. Non-rebreather masks can reach oxygen delivery concentrations between 60 and 95%. Non-rebreather masks have a reservoir bag that stores free-flowing oxygen until it is inhaled. One-way valves help ensure high oxygen concentrations are delivered by keeping outside air out of the mask and exhaled air out of the reservoir bag. Use the highest flow rate available, between 10 to 15 liters per minute. To ensure high oxygen concentrations, make sure the mask seals well around the patient's face and that the reservoir bag never deflates below 1/3 full. A nasal cannula is not considered a high oxygen concentration delivery device. Up to 40% oxygen concentration can be delivered with this device at a maximum flow rate of 6 liters per minute. It has limited application in an emergency, and its use is not covered in this program. Other delivery devices are used when a patient is not breathing. These devices use a provider's breath or a compressed bag to force oxygen into the lungs of the patient. A ventilation mask with connected oxygen flowing can increase the oxygen concentration of rescue ventilations from approximately 16 to 17% found in the rescuer's exhaled air to about 50%. Masks are cleared to detect vomit or other foreign material and are equipped with a one-way valve for protection from disease transmission. Use the highest flow rate available, between 6 and 15 liters per minute. Establish an airway before ventilating and make sure you see a visible rise of the chest on every ventilation. A bag mask device, or BVM, uses pressure created by squeezing a self-refilling bag to force air containing oxygen into a patient. With an attached reservoir bag connected to a 10 to 15 liter per minute flow of oxygen, this device can provide nearly 100% oxygen concentrations. A BVM is primarily an option for healthcare professionals and professional rescuers. Although all emergency oxygen delivery systems include the same basic features, individual systems may have other unique features to consider. Some systems automatically begin the flow of oxygen once dislodged from their storage case. A pre-connected ventilation mask ensures a unit is ready to use in an emergency. Other systems are designed with a fixed flow regulator, so you simply move a lever to begin oxygen flow. Rugged cases can protect pressurized oxygen cylinders from being damaged. Some systems are disposable. These systems typically cost less and can be discarded after use. Although a wide variety of systems and delivery devices are available, your training needs to be specific to the emergency oxygen systems you would use in an emergency.